So what we're going to look at now is the non-contractile properties of the knee. So because some of the insertions and origins comes from the hip, we'll give a quick brief of the hip. So basically we've got the femur, the tibia and fibula, and the patella also. So we'll start at the top here. We've got the femur head, the femur neck, the greater trochanter and the lesser trochanter. And that's that. We'll swap around quickly. Then we've got this side. This is the peroneal line here, the pectineal line here, sorry. Then we've got the gluteal line, the gluteal tuberosity, sorry. And then when these two triangles form here, this is a linea aspera just around this area here. And that's that. What else have we got going on here? We've got the popliteal line here as also, and we've got the lateral supracondylar ridge of the femur and the medial supracondylar ridge of the femur also. Then we've got the adductor tubercle, which just sits just around about this area there also. Then we've got the, I'll turn it back around to make it a little bit easier for myself. Then we've got the medial epicondyle of the femur and the lateral epicondyle of the femur, and we've opened it up a bit. That's the medial condyle and the lateral condyle of the femur. That's them. What else we've got? We've got the intercondylar fossa here, which is this bit here also. Then we've got the lateral meniscus and the medial meniscus, and we've got the patella. So we've got the base of the patella, the medial border of the patella, the lateral border of the patella, and the apex of the patella. And that's that. Then we've got the head of fibula. What else we're missing there? We've got the tibial tuberosity also, which, if I can just spin this leg back round, is there. So this area here, that's where that is. And what else have we got? We've got the medial condyle of the tibia and the lateral condyle of the tibia also, and that's them. Have a quick double check, see if I've missed anything. We've got the patellofemoral groove, which is here also, and I think that's it. Now we'll talk about the joints. So the joint, which the articulation between the femur and the tibia, so it's called the tibiofemoral joint. So that's the knee joint, and this is a synovial hinge joint, which allows flexion and extension, and to some extent some sort of rotation. Then we've got the patellofemoral joint, which is the patella, which is the articulation with the patella and the patellofemoral groove. And we've got the medial part of the tibiofemoral joint here and the lateral part of the femoral joint there. And this articulation is between the lateral meniscus and the lateral condyle of the femur, and the medial part is the medial meniscus and the medial condyle of the femur there also. And that's that. Then we've got the proximal tibial-fibular joint, which is this area here, and this is a synovial hinge joint, not a synovial gliding joint, which allows a certain degree of rotation, but also a bit of extension also. And that's the joints there. Now we'll talk about the ligaments themselves. We've got the ACL and PCL. The PCL originates from the medial aspect of the intercondylar fossa, and it inserts to the posterior surfaces of the intercondylar area. The ACL comes from the lateral aspect of the intercondylar fossa and inserts to the anterior surfaces of the intercondylar area. And the posterior prevents too much posterior translation of the tibia, so this movement there is coming backwards, and the anterior cruciate ligament prevents too much anterior translation, which is the tibia coming this way. Then we've got a medial cruciate ligament, which originates from the, it's got a deep and a superficial ligament. So the deep one comes from the medial meniscus, the superficial comes from the posterior aspect of the medial epicondyle. It comes through the pes insernius insertion, which is around about this area here. And what the medial collateral ligament does, it prevents too much of a valgus force, so anything like a trauma blow from the lateral part, which is going to do that, prevents that. Then we've got the lateral cruciate ligament, which comes from the lateral epicondyle femur and inserts the lateral aspect of the fibula, and this prevents too much of a varus force, so something a medial blow, so that prevents that. Then we've got two retinaculums. We've got a lateral retinaculum and a medial retinaculum, and these play more of a ligament role instead of a retinaculum role, as this provides stability to the patella and keeps it in place. Then we also have got the transverse ligament. The transverse ligament just sits anteriorly to the anterior cruciate ligament, and it connects these two cartilage or menisci together, and these menisci prevents the bone rubbing against bone, and that is the non-contractile properties of the knee.